Sure.
Hello there, my name is Nitin Patel, clinical pharmacist at the Russell Hall Hospital in Dudley. The menopause can be one of the more distressing periods in a woman's life, with some marked changes happening in her body, most notably the loss of periods. Symptoms that might be suffered from include night sweats, irritability, hot flushes, and a condition known as osteoporosis, in which bone mineral density decreases, resulting in possible fractures. These changes happen because of a decline in estrogen and progesterone, the woman's natural hormones, which decline as a woman ages. There are measures to counteract these symptoms, one of them being hormone replacement therapy, or HRT for short. This can take the form of tablets, patches, implants, and contain hormones that are similar to estrogen and progesterone. There are two types of HRT, those that contain estrogen on its own and those that contain a combination of estrogen and progesterone. The estrogen-only HRT is reserved for women who have had a hysterectomy, i.e. have had their womb removed, whilst the combination product is reserved for women who still have an intact womb, and this is for the progesterone component to control the womb lining and to control its growth, which, if left to proliferate, could result in possible cancer of the womb. Yeah. Now, there are scare stories that have been reported in the media regarding the risks and dangers of HRT, such as the increase of breast cancer and the increased risk of strokes. And these stories aren't totally unfounded. However, they have been reported in a way to make them sound a bit more worse than they actually are. There are risks. However, these risks should be taken into context of each woman who presents with menopausal symptoms. And actually, HRT can be great for women who can't tolerate other therapies. It's not all doom and gloom when it comes to HRT, and those same studies that have reported on the risks of it have actually found benefits of it, such as a reduced risk of colorectal cancer and fractures from osteoporosis. When it comes to prescribing HRT, there are a number of factors that would have to be ruled out before a prescription could even be considered. A family history or previous history of breast cancer would be an outright contraindication, as would a previous history of blood clots. Undiagnosed vaginal bleeding would have to be investigated before anything could be done, as well as liver impairment or uncontrolled hypertension. If there aren't any obvious reasons as to why HRT should not be prescribed, then conversations can take place between the patient and the prescriber, and symptoms that the woman will be suffering from can be discussed. HRT works well to alleviate the symptoms of menopause, like the night sweats and the hot flushes. HRT can be used as a treatment option in osteoporosis if a woman can't tolerate bisphosphonate treatment for whatever reason. Now, the studies have shown that HRT can increase the risk of breast cancer and strokes, and it's for this reason that HRT should only be prescribed for 5 years, preferably not any longer, and with constant reviews by the doctor.
Go.
Now, there are alternatives to HRT should only certain symptoms be suffered from.
For instance, a common problem faced by menopausal women is vaginal dryness, but there are estrogen creams that can be applied locally to the vagina that help to alleviate symptoms that would avoid the high doses that would reach the bloodstream from HRT in the form of tablets and patches.
Each woman should be reviewed on an individual basis, and her past experiences and beliefs about HRT should be taken into consideration before an informed decision can be made regarding whether she should be initiated on it or not. Thanks for listening. If you have any questions, please leave them in the comment section below, and I'll try and get back to you. Bye-bye.